Well, the infections among healthcare workers in Indonesia is indeed raising concerns about the efficacy of some vaccines against the more infectious COVID-19 variants. Let's find out what's happening on the ground. Science journalist Dewi Safitri of CNN Indonesia joins us now live from the capital of Jakarta. Dewi, thank you so much for joining us. What more can you tell us about these medical doctors who have been infected with COVID-19 after getting immunized with the 2 doses of Sinovac? Because, you know, Dewi, many Filipinos are also concerned here in the Philippines because the government has ordered millions of these Sinovac vaccines for our healthcare workers and for the population.
Rico, thank you for having me. Unfortunately, for the time being, we don't have an official figure about how many medics who are infected by the COVID after their complete dosage of vaccination. At best, well, we knew for sure that there are at least hundreds of them got infected, but the estimate could go as high as 1,000 of them. But this is, of course, concerning because the infection happening exactly at the worst wave of pandemic in Indonesia. As of today, the government announced that there are almost 13,000 new cases confirmed, with almost 300 cases. So it's really, really bad in Indonesia. The fact that health officials, the health facilities are inundated with influx of new patients running out of intensive care units, and now the caregivers themselves were infected with COVID is really unfortunate. That it couldn't happen at a worse time than this. But it's important to note that infection symptoms are mild in most cases, and no death, fortunately, have been reported from these cases.
Yes.
So that's a positive note, at least. Another note to take from this.
Dewi, I'd like to jump in here, no, because just like the Philippines, Indonesia has also ordered a huge bulk of these Sinovac vaccines. How concerned is the Indonesian government at this point about the efficacy of the Sinovac vaccine against the various virus strains that are currently spreading around the country?
Judging from the policy and strategy so far, obviously the government is highly concerned. We knew from the start that the Sinovac efficacy is lower than those in the market, namely, you know, Pfizer, AstraZeneca, or Moderna. But with Sinovac and other vaccines as well, our target is really to lower the severity of disease and therefore the severity of treatment. The deal with Sinovac has been initiated by the government of Indonesia months ago at the start of the pandemic, when the vaccine availability is nowhere near certain. So it's not like we have the luxury of choosing from an array of premium choices in what vaccine is available for us. So
Dewi,
any vaccine, at least one that is scientifically vetted, is better than no vaccine at all.
That's true. A vaccine is better than no vaccine at all. But tell us about the vaccine rollout in Indonesia. How many Indonesians have already been fully vaccinated? Because here in the Philippines, less than 2 million people out of the 108 million population have been only fully vaccinated.
Right. As of today, we have 22 million people vaccinated with the first dose, and then 12 million people vaccinated with a complete dose, both from the Sinovac, the AstraZeneca, or others. So all in all, about 34 million doses have been inoculated so far. This may look big in numbers, and in fact, we are among the highest vaccination progress in Asia. But if you look at the whole number, we have a target of 1 180 million 181 million people to reach the herd immunity, the goal is still very, very far. In fact, I think the Philippines may get ahead of us in terms of reaching the herd immunity goal. Rico.
Thank you so much for that information from Indonesia. Science journalist Dewi Safitri of CNN Indonesia joining us from Jakarta.